Leeds became a fast track city in February 2023, and we're really proud and excited to be able to celebrate our first year as a fast track city. Fast Track Cities is a global initiative. We have signed up as a city to ensure that by 2030, no new HIV, hepatitis B or C or TB new infections, and more importantly, we have signed up as a city to eliminate all stigma related to these infections. During our first year as a fast track city, we've strengthened partnerships across the city, nationally and internationally. We have done lots of work in setting up a leadership group and subgroups. We've identified gaps in where we want to improve testing across the city, and lots of other projects that we've got for the next year, including more community engagement, more HIV prevention work, more testing in A&Es and in the TB community setting as well. Again, most importantly is the anti-stigma work that we're planning to do. So as a fast track city in Leeds, we are more united than ever to ensure that we achieve our 2030 goals.
I was diagnosed in April 2003 after receiving a phone call from a regular partner, and I was also tested positive for HIV. The challenge has been that I've kept it very secret to myself, only sharing it with people that I trusted, whether it's employers or very close friends, but it did feel like a dirty secret in a way. I couldn't really speak openly about it. After having, I didn't have no symptoms whilst being when I got diagnosed, and also didn't have any symptoms feeling ill. A few years later, I felt that I was becoming ill. I'd admitted to hospital, and the treatment that I received in hospital kind of catapulted myself to actually make changes of how I was treated as a HIV and gay Asian man. After being admitted onto the infectious disease ward, and the support and the care that I received on the ward changed my perception. I wanted to make improvements, and I started to train as a nurse and to make those changes in healthcare. What I would say to someone is that it's just reassurance for yourself, reassurance for your partner, or maybe other people that you're in contact with. The treatment is not as bad as it may have been 20 years ago when I was diagnosed. Once being diagnosed, I'm on one tablet a day, which I'm feeling quite healthy about, and the treatments, what you do get within the clinic, is fantastic. The staff are very supportive. So I would say to somebody to be tested, and the support and the care is available whenever you need it.
I work on reception at Kergate, and I'm also the Hep C champion for our Kergate hub. I feel it's just so good that I can just test them whenever they want, you know what I mean? All they have to do is ask. They'll just ring up and say, oh, I think I might put myself at risk. Can I come in? And I say, yeah, just pop in anytime. It's absolutely fine, you know, we'll test you. I think in our reception there's a lot of information about Hep C, and the clients talk about it openly. And it's no longer really a taboo subject. Forward Leeds, we're working towards micro-elimination of hepatitis C, which we hope to achieve by the end of this year.
So our role is identifying tuberculosis, preventing tuberculosis, and also supporting patients with active or latent TB through treatment. We also raise awareness in the community and offer briefings to other organisations. I think one of the main issue when people are diagnosed is shock. But we just like to reassure people TB doesn't discriminate. It affects people of every age, gender and ethnicity, and it is treatable if people come forward and are tested and adhere to treatment.
So part of the TB role is meeting the patient at the beginning of the journey, and that's really important to get to know them, to understand their priorities, identify any health needs they have, and for us to collaboratively work together to try and break down barriers to reduce any health inequalities and ultimately try and achieve a really good outcome for them.